So we're going to talk about the facial bones. As you remember from part 1, which feels like it was 2 days ago, we have two unpaired bones. The mandible, here's the mandible, and the vomer is this yellow bone in this model right here inside your nose. It's making the inside of your nasal septum. So if we look at this guy, this is the vomer right here. And if I pull him up, see the yellow bone in the center of the nasal cavity making the inferior portion of the septum? That's the vomer. So those are the unpaired bones. All the other bones are paired. We have paired nasal bones, uno, dos. We have paired lacrimal bones. So the lacrimal bones are these yellowish bones right here inside the eye socket. And they have a very important fossa right there that is going to let your tears run from your eyes into your nose. We have the zygomatic bone. Who can't love a bone that starts ZY? We have paired maxillary bones. If we look again into the nasal cavity, you see this lilac colored bone right here? There's two of them, one there, one there. That is the inferior nasal conchoidal bone. Now, if I look at the bottom, I have the palatine bone. And the reason why I keep pausing is my screen and what I'm actually looking at are two completely different things, and it is very confusing. So this is the palatine bone. So I pulled the facial bones off so you can see them a little better. The vomer right here would actually be sitting right here in the nasal cavity. Hi, I'm the vomer. So these are the bones, and if I turn it to the posterior, I can actually see here the inferior nasal conchoidal bones. Here are the palatine bones. So the palatine bones are actually quite big. They form part of your nasal cavity, actually. And while I'm turning this, we could actually see the maxillary sinus right there. Again, remember when I was talking about the sphenoid bone, you have these holes in your head called sinuses that reduce weight. And we could see the nice yellow lacrimal bones. So let's talk about these bones now. So the zygomatic bone is your cheekbone right here. And this is what it looks like if I take it off. So let's actually take our bone off. So here's the zygomatic bone. It has three processes. This process up here is touching the frontal bone, so it's called the frontal process. This process is touching the maxillary bone, so it's called the maxillary process. This bone is touching the temporal bone, so it's called the temporal process. So the zygomatic bone here does not have a zygomatic process. So if I look at the skull, oops, out of the way, please. If I look at the skull, here's the temporal process, here's the zygomatic process. They touch to form the zygomatic arch. Here's the zygomatic process, here's the frontal, here's the zygomatic process of the frontal bone, here's the frontal process of the zygomatic bone, and lastly, this one isn't a great process, but still, zygomatic process of the maxillary process of the zygomatic bone. So the processes are named for the bones they touch. So here's the zygomatic bone. By the way, all these rotating models are from this website. I have to list it. Sometimes this is getting cut off. I'm not doing that intentionally. So that's the zygomatic bone. Temporal process, maxillary process, frontal process. Here's the maxilla. So here's the maxilla. It is actually two bones. There is a suture right there. And of course, we have a frontal process right there because it's touching the maxillary process of the frontal bone. We have a zygomatic process right there because it is touching the maxillary process of the zygomatic bone. We have a palatine process. What would the palatine process be? Well, let's look over here. Now, we have our nice blue maxilla. We have our nice orchid palatine bone. This is the palatine process. And these two, the palatine process and the palatine bone, make up a structure called your hard palate. That's the bony part of the roof of your mouth. So that would be the palatine process right there. Now, I'm forgetting an important process. My dentist is my neighbor. He might be walking by at any second to yell at me for not skipping this process. See these processes where the teeth are anchored? So these processes right there, those are called alveolar processes. They hold the teeth in place. So again, you are my witnesses. I talked about the alveolar processes. So when my neighbor just happens to wander by to make sure I'm teaching it, you can tell him I taught it. Now there's a cute process. It's not on your study guide, but this process, our foramen, this foramen is the infraorbital foramen. Remember how the superior part, or the part of the frontal bone that's the superior part of the eye socket has a supraorbital foramen? Well, this is the inferior part of the eye socket, so that's the infraorbital foramen. See why you have to learn inferior and superior? So your mandible is your jawbone, and this is what it looks like. It's a very cool shaped bone. And again, we learned this is the mental region right there. And your chin sticks out, so it's called the mental protuberance. That's they're one of those words they just like saying. Now, these are foramen. These aren't that clear, but these are foramen. In your mental region, what should we call a foramen in the mental region? I know, mental foramen. So anatomists, they like naming things for where they are now. It's no longer named after Golgi and Purkinje and Hennel. So these are mental foramen because they're next to the mental protuberance. Now remember I talked about the teeth in the maxilla, that they're held in place in alveolar processes. So these would be alveolar processes again. So moving on, this is the body. This is the angle. Then a flat, straight piece is a ramus. There are 3 ramuses I'm going to teach. I guess there's 4 ramuses I'm going to teach you. One of them will be on your lab exam, definitely, because it's a ramus. A ramus is literally meaning branch, but it's a straight, flat piece in a bone. So this is the ramus of the mandible. Now, we have a rounded structure right here. And I'm going to switch bones in a second. Much better without the bone with a spring sticking out of it. So I have a paired, round structures right there. And they're going to articulate with the temporal bone in a fossa. So what do we call paired, round, articulating landmarks? Condyles! These are mandibular condyles. So those are the mandibular condyles. Technically, they are on the head. Now, I'm going to teach you this process because muscles attach here. They actually attach all over the ramus. This is the coronoid process. Not to be confused with the other coronoid process of our body or the coracoid process of our body. This is a coronoid process. And basically, the ramus, the head, the coronoid process, they're all going to be attachment points for muscles of chewing. The fancy name of chewing is mastication. So we actually need to know what these structures are because you need to close your mouth and open it to chew. So these are condylar processes right here with condyles on the top. And I've seen them called the head also. I don't like it calling it the head because there's 2 of them, and on all other bones there's only 1 head. We have the coronoid process right here, and that's going to be the insertion for the temporalis muscle. Insertion means where it attaches to move. The ramus is this long, flat part. This is the angle. This is the body. Mental foramen are the holes right here, and the mental protuberance is the chin. And how can I forget? The alveolar processes are these things that the teeth are sunken into. So the remaining facial bones are really small. These are the nasal bones. They make up the bridge of your nose. And if I rotate it a little bit, this bone right here is the lacrimal bone. And it has this nice fossa called the lacrimal fossa. And when you cry, that's supposed to drain tears. So when you catch your significant other cheating on you with your best friend, and they're taking your dog too, and you cry and cry and cry, well, the tears are running down that and then into your nasal cavity, then out your nose. That's why your nose is running. So that is the lacrimal bone. So if I look at our non-take apart of the skull, the lacrimal bone is right here. That's the lacrimal fossa. See why I like the colorful ones? Because I could clearly see it, even though I can see the sutures on this. Showing you the posterior view first. Here are the lacrimal bones. Here is the palatine bone. So the palatine bone is actually a pretty big size bone. It's just going up and forming the posterior lateral and posterior inferior walls of the nasal cavity. And then if we look inside, that is the inferior nasal conchal bone. Remember the ethmoid had the superior and inferior nasal concha? Well, that is the inferior. Guess its only structure is also the inferior nasal concha. And these basically cause resistance as you breathe in air. It slows down air going into your nasal cavity so it can be warmed and moistened. So I'm going to split this open. My daughter's going to be so jealous that I took this apart without her. Here's the nasal bone. That is the lacrimel bone. Lacrimel means tears in Spanish and Latin. I was so disappointed. I thought it was named for a guy. This is the inferior nasal conchal bone. We could see the maxillary sinus up here, and that is the palatine bone. This is the palatine process of the maxilla. And lastly, your vomer would be something like that. The vomer is actually anchored in the skull to the sphenoid bone, so I can't really show you what the vomer would be like. But it's basically making up the inferior part of your nasal septum that divides your left nostril and your right nostril. So I've titled this the facial bones in the nasal and oral cavity. So the vomer is going to make up the medial border. Then we have the inferior nasal conchal bone right there. We have the maxilla. We have the palatine bone. And we have a couple of our cranial bones also. That's the ethmoid, so the superior and middle nasal concha. This is the sphenoid bone. It's actually making up the posterior part of your nasal cavity. And we could see two more sinuses. There's the sphenoid sinus and there's the frontal sinus. And again, I will talk about sinuses, but not yet. So, the lacrimel bone. This bone literally means tear bone. It is part of your orbit. So here's your orbit. That's the zygomatic bone. That's the maxilla with your infraorbital foramen. This is the frontal bone with your supraorbital foramen. There's a sphenoid bone with the optic canal hiding in the back, the superior orbital fissure and an inferior orbital fissure. I didn't mention that. So the lacrimal bone is making up the anterior lateral wall. Anterior medial wall. Most of the medial wall is actually made up by the sphenoid bone right there. So that is the lacrimel bone. And you could see it in green right there. Again, all of these rotating models are from the same website. It's literally in the terms of use, so I have to say it. So see, median wall of the orbit, that is the lacrimel bone, and most of it is this cool ethmoid bone. So finally, the 4 paranasal sinuses. A sinus is just a cavity inside the bones. So in long bones, they have the medullary cavity to make them lighter. 4 of your skull bones have sinuses. It's thought to help make them lighter, but they have a mucosal layer that produces mucus. They have lots and lots of goblet cells that are making lots and lots and lots of mucus. And the job of this mucus is to warm and moisten the air. And there are 4 sinuses. Now what's weird is it's paranasal sinus. The nasal bone doesn't have a sinus. It's way too small. The 4 paranasal sinuses are in the maxillary bone. Remember I point out the maxillary sinus. In the sphenoid bone. In the ethmoid bone. And again, they're called air cells. I'm making sure I'm not saying hair. The frontal sinus. So this reduces weight and it makes for producing lots of mucus. So here's the sphenoid, ethmoid, frontal, and the maxillary would be in there. So this is the maxillary sinus right here. This is actually the one that drains from the top. So apparently a lot of people have problems with this sinus, and they treat it, or at least 10 years ago they still treated it by drilling holes to drain it down here. Sounds lovely. Your ethmoid bone, these air cells are always shown drawn from the top. They really are draining into the nasal cavity though. This would be a couple more of the air cells, I believe, how they made this model. So, and in the classroom, we would have a very cool model of this bone as well. So that is the second one. So here's the sphenoid bone. Again, optic canal, foramen rotundum, optic canal, foramen rotundum. So this is the sinus in here. Again, the sinus really isn't blown open like this. they made the model so you could see the sinuses.